What causes sciatica and how do you get rid of it? Sciatica is an incredibly common problem, and there's a good reason for it, that it's not something simple and concrete. In fact, it's not just one thing. And the diagnosis of sciatica doesn't get you any closer to finding a cure for it. So the first thing that you need to do to help get your sciatica better is to figure out what's causing it. And that's what I'm going to walk through in this video. I'm Dr. Dave Candy. I've been treating patients with back pain and sciatica for 15 years, and I've become very experienced in helping find out where the problem is coming from and then what solutions are needed to treat it. And it's not always the things that you'd commonly think would help. So in this particular video, what we're going to walk through is the various different things that can cause sciatica. And all sciatica really means is pain in your back, in your buttock, down your leg, or in the calf, or any combination thereof between those. So what actually causes sciatica? Well, there are a lot of different things. So let's start from the most common thing and then kind of work the way down from there. So the most common thing that causes sciatica, if I had someone walk into the office and say, hey, I've got this pain in my buttock and my leg and down in my calf, the very first thing that I would think of is a back problem. And you would have to prove that it's not that before I would decide that it's not a back problem. That is the most common cause of sciatica, but even within that subcategory, there are a lot of different things within your back that can give you symptoms of sciatica. For example, you can have a bulging disc or a herniated disc or a degenerative disc, and those are the things that people typically associate with sciatica. But you don't actually have to have those on your MRI in order to have symptoms of sciatica. And patients get really frustrated when they have all this pain that's going down their leg and they go to the doctor and they get an MRI and they say, hey, it looks fairly normal. And that's good news, but it actually kind of frustrates people because they want something on the image that they can poke down and say, hey, that's causing it. But the opposite is just true as well, that sometimes people have things that just naturally appear on MRIs, like bulging discs or herniated discs or degenerative discs. And those happen in a lot of people without any pain. But then when it happens in someone who does have pain, they sometimes associate that thing that they saw on the MRI with the symptom they're having, when in fact it may be the cause or it may be coming from something different. But if you do have something in your back that's causing sciatica, you really need to determine what causes it. For example, is it a problem of your spine being too arched this way? Or is it a problem of your spine being too flat? And either one of those can cause sciatica. So in order to find the right treatment, you really have to figure out which one of those it is. Now, to make it even a little bit more complex, your muscles can actually cause symptoms that refer down into your butt and down into your thigh. Usually muscle pain doesn't go past the knee, but people refer to sciatica as a lot of different things. Truly what I think of when I hear sciatica is pain in the butt, back of the leg, and then down into the lower leg as well. But some people will call just butt pain sciatica. Some people will call butt and thigh pain sciatica. Some people actually call pain in the front of your thigh, which is actually your femoral nerve, not your sciatic nerve in the back of the leg. But sciatica is not a very clear term among the lay public or among the medical community. And that's one of the reasons why it's such a common problem, because there's no real agreement on what exactly the term means to begin with. And it's got multifaceted causes. So let's move down from the back. Let's say that you have figured out that it's not coming from your back, that it's coming from somewhere else. That you can move your back and bend and do things pain-free, and that doesn't trigger your sciatica. It doesn't make your sciatica any better. It doesn't make it any worse. It's just kind of the same. So next we would move down to your hips. And that could be coming from your actual hip joint. Your hip joint can refer pain down your legs. More commonly, it's coming from the actual sciatic nerve in the buttock. And that sciatic nerve kind of comes out of this area between your hip and between your tailbone. There's a little soft spot there. And that's where your sciatic nerve runs. So if you spend a lot of time sitting, particularly if you sit more on one cheek than the other, that can put pressure on the sciatic nerve in the buttock. And there's a muscle there that your sciatic nerve runs under or through. It's one of 6 hip rotator muscles. But this one, particularly the piriformis, is the one that gets all the bad rap and all the bad press for causing sciatica. And the piriformis, when you have sciatica coming from your buttock, people will often try to stretch their piriformis. And that can be done either sitting in a chair with your leg crossed or laying on your back and crossing your leg and pulling your leg up toward your chest, even kind of pulling your piriformis or your knee towards your opposite shoulder. But stretching your piriformis isn't necessarily always the greatest idea, because sometimes sciatica pain from your hip or piriformis syndrome can be caused by a piriformis that's too stiff and needs to be stretched. At other times, it's actually caused by that muscle being chronically over-lengthened and getting stretched over top of the sciatic nerve every time you stand on one leg and your hip drops out and that piriformis muscle gets stretched and pulls over the sciatic nerve. And so if that's your problem, further stretching out that muscle isn't going to help and might even make it a little bit worse. So you really need to determine whether your piriformis syndrome is coming from a piriformis that's too short and stiff or a piriformis that's been chronically overstretched. Now, if you move down from there, your hip muscles can actually cause sciatica symptoms, particularly the muscles in the side of your hip, your gluteus medius and your gluteus minimus, can refer pain down the side of your leg in the same distribution as the L5 nerve. And so a lot of people will mistake that problem for an L5 problem coming from their back. And sometimes they'll get injections and be frustrated that, hey, I have this bulging disc at L5, I've had injections at L5, why is this problem not getting any better? But if it's truly a hip problem, you really need to address the hip in order for that problem to resolve itself completely. And so that's why it's really important to find the cause of your sciatic pain. Now, what else can cause sciatica? Yes, there's actually more. If you have stiff hamstrings, that can put pressure on the sciatic nerve, but stretching stiff hamstrings isn't always the best choice if you have sciatica. Now, just about every person on the planet thinks that they have tight hamstrings. Even if they can put their leg up over their head, people still feel like at their end range that it feels stiff. But truly, if you can raise your leg about 90 degrees to your body like that, that's a pretty normal length of your hamstrings. But when you do have a sciatic problem, when you go out into that position like that, or when you bend all the way, you're putting tension on that sciatic nerve. And that can actually kind of irritate the problem sometimes. So even if you have some stiff hamstrings, it's not always the best idea to stretch them out. And doing that, particularly if it's painful when you stretch them, can actually pull on the sciatic nerve and make the problem even a little bit worse. Now, moving down, there's one last spot that can cause symptoms of sciatica, and that's actually a trigger point in the back of your soleus muscle or in the back of your calf muscle, and it can refer pain up. It's not so common that muscles refer pain closer to the spine, but this trigger point actually does refer pain up into the butt and the SI joint and can cause symptoms of sciatica. Now, maybe not so coincidentally, there's also a branch of your sciatic nerve that runs right through this area called the common fibular nerve or the common peroneal nerve. And that trigger point in your soleus is right along that pathway of the common peroneal nerve. So I found that people who have trouble with that area there, that stabilizing the joint between your fibula, the little bone on the outside, and the tibia, the big bone on the inside of the shin, can help give them some relief. Additionally, some trigger point therapy on that trigger point in your soleus can be helpful. So again, just to review, if you are having symptoms of sciatica, which again is pain in your buttock, in the back of your leg, and then down in your lower leg somewhere, that can be caused by a back problem. You're having too much arch in your back, or having your back be too flat, or having certain muscles in your back be too stiff. It can be caused by a hip problem in your hip joint, in the sciatic nerve in your buttocks itself, or in the muscles in your hip. And it can also be caused by hamstring problems, where the sciatic nerve runs down your leg, or the branches of the sciatic, the peroneal or the fibular nerve, and the trigger points in your soleus muscle. So that's a lot to unpack, and it's hard to face that all by yourself. So if you are experiencing symptoms of sciatica, I'd recommend reaching out to a healthcare professional. Now, if you happen to be in the St. Louis area, we do have a clinic here in St. Louis called More for Life. You just reach out to us at our website. We'd be happy to help you figure out what's causing your symptoms and then what you can do to get some relief. Now, if you're watching this from somewhere else in the world, you can also download my sciatic nerve relief course at relievesciaticnervepain.com. I'll put a link here in the description, but that's an online course that helps you figure out where your problem is coming from on your own and give you some solutions that you can walk through at home. And if you did find any of this in this video interesting or helpful, give it a like and subscribe to our channel so you can get more tips to help you stay active, mobile, and healthy without pain. Thanks so much for watching, and have a great day.